What if better sleep after 60 didn't require another pill, but just 3 simple minutes before bed? Good evening, I'm Dr. Mark Hyman, and welcome to Dr. Mark Hyman Official. With over 10 years of clinical experience in medical practice, I've worked closely with older adults struggling with poor sleep, nighttime awakenings, and restless legs. One of the most common complaints I hear is, "Doctor, I wake up again and again during the night, but what if the solution isn't complicated?" Today's topic is, this 3-minute leg position before bed is why some seniors sleep all night. It's simple, it's natural, and for many seniors, it's surprisingly effective. Let's begin. Sleep challenges naturally increase with age due to several physiological and lifestyle changes. As people grow older, their internal body clock or circadian rhythm begins to shift. Many seniors feel sleepy earlier in the evening and wake up earlier in the morning. This shift can reduce overall nighttime sleep and make it harder to stay asleep for long, uninterrupted periods. In addition, the body produces less melatonin with age, the hormone responsible for regulating sleep cycles. Lower melatonin levels can make falling asleep and remaining asleep more difficult. Another contributing factor is lighter sleep. Older adults tend to spend less time in deep, restorative stages of sleep and more time in lighter stages. This means they are more easily awakened by small disturbances such as noise, discomfort, or minor physical sensations. Even subtle changes in room temperature or slight aches in the body can interrupt sleep more easily than in younger years. Circulation changes also play a role. As we age, blood flow efficiency may decline slightly, and fluid can accumulate in the lower legs throughout the day, especially after prolonged sitting or standing. When lying down at night, this fluid redistributes throughout the body, sometimes increasing kidney activity and leading to more frequent nighttime urination. These repeated trips to the bathroom significantly disrupt sleep continuity. Chronic conditions common in seniors, such as arthritis, mild heart changes, or nerve sensitivity, can further fragment sleep. Even medications prescribed for common age-related conditions may have side effects that interfere with rest. All these factors combined explain why many seniors experience frequent nighttime awakenings. Understanding these natural changes helps identify simple, supportive strategies that can improve comfort and promote longer, more restful sleep without immediately turning to medication. Fluid pooling in the lower legs during the day is a common but often overlooked reason for disrupted sleep in older adults. As we age, circulation can become less efficient due to reduced vein elasticity and weaker calf muscles. These muscles normally act as a pump, helping blood return from the legs back to the heart. When someone sits or stands for long periods, gravity causes fluid to accumulate in the feet, ankles, and calves. Over time, this can lead to mild swelling, heaviness, or tightness in the lower legs. While this buildup may seem harmless during the day, it becomes more noticeable at night. When you lie down, gravity no longer keeps fluid in the lower extremities. The fluid begins to redistribute into the bloodstream and upper body. This increase in circulating fluid signals the kidneys to filter and remove the excess, resulting in increased urine production. As a result, many seniors wake up multiple times during the night to use the bathroom, a condition known as nocturia. These interruptions break the natural sleep cycle and make it difficult to achieve deep, restorative sleep. In addition to frequent urination, the sensation of fluid shifting can contribute to leg discomfort. Some individuals experience throbbing, tingling, or restlessness in the legs when lying down. This discomfort can delay falling asleep and lead to repeated awakenings. Addressing fluid pooling before bedtime can help reduce these nighttime disruptions. By encouraging fluid redistribution earlier in the evening, the body has time to adjust before sleep begins. Managing circulation in this simple way can support more consistent rest, reduce nighttime awakenings, and improve overall sleep quality in older adults. A simple 3-minute leg elevation before bed can make a meaningful difference in sleep quality, particularly for seniors who experience mild swelling or nighttime awakenings. This gentle position works by using gravity in a beneficial way. Instead of allowing fluid to remain pooled in the lower legs until you lie down to sleep, elevating the legs slightly above heart level encourages redistribution earlier in the evening. By doing this intentionally before bedtime, the body has time to rebalance fluid levels before you fully settle into sleep. The position itself is straightforward and does not require special equipment. You can lie on your back and place your legs against a wall or rest them comfortably on pillows so they are elevated just above the level of your heart. The key is comfort and relaxation. The knees should remain slightly bent if needed, and the lower back should feel supported. Remaining in this position for about 3 minutes is often sufficient to begin the fluid shift process. This short practice can reduce the sudden redistribution that typically happens after you fall asleep, which may help decrease nighttime trips to the bathroom. It can also ease feelings of heaviness, tightness, or mild swelling in the calves and ankles. By relieving this pressure earlier, your legs may feel lighter and more comfortable when you transition into bed. Consistency enhances the benefit. Making this a regular part of a bedtime routine signals the body that it is time to unwind. Over time, this small habit may support more stable circulation patterns at night. Simple, intentional positioning before sleep can contribute to longer, less interrupted rest without the need for medication or complicated interventions. The 3-minute leg elevation technique does more than just improve circulation. It also promotes relaxation by calming the nervous system. As we age, stress and physical tension can accumulate throughout the day, making it harder for the body to transition smoothly into sleep. Elevating the legs while lying comfortably on your back encourages a gentle shift in blood flow that supports cardiovascular balance. When combined with slow, controlled breathing, this position can activate the parasympathetic nervous system, often referred to as the rest and digest system. The parasympathetic response slows the heart rate, lowers stress hormone levels, and reduces muscle tension. This is especially important before bedtime, when the body needs to move from an alert state into a restorative one. Many seniors experience difficulty winding down at night, particularly if they have been mentally active, worried, or physically uncomfortable during the day. The simple act of pausing for 3 quiet minutes in a supported, elevated position encourages stillness and mindfulness. Breathing plays a key role in enhancing this effect. Taking slow, deep breaths, inhaling through the nose for 4 seconds and exhaling slowly can further calm the mind and body. This combination of physical positioning and controlled breathing creates a gentle signal to the brain that it is safe to relax. Reducing nervous system tension before sleep can help decrease nighttime restlessness and make it easier to fall asleep naturally. Instead of going directly from activity or screen time into bed, this brief transition period allows the body to settle. By encouraging both circulation and relaxation, this simple practice supports a smoother shift into deeper, more sustained sleep throughout the night. One of the greatest advantages of this simple leg elevation routine is that it is completely drug-free and easy to incorporate into a nightly habit. Many seniors turn to sleep medications when they struggle with nighttime awakenings or difficulty falling asleep. While medication can sometimes be appropriate, it often comes with potential side effects such as dizziness, confusion, next-day drowsiness, or increased fall risk. A natural technique that supports the body's own physiology offers a safer first step for improving sleep quality. This routine requires no special equipment, no cost, and no complex instructions. A wall, a comfortable surface, or a few supportive pillows are all that's needed. Because it takes only 3 minutes, it does not feel overwhelming or time-consuming. In fact, its simplicity makes it easier to practice consistently, which is key to experiencing long-term benefits. However, while this method is gentle, it is not suitable for everyone without consideration. Individuals with certain medical conditions, such as advanced heart failure, severe circulation disorders, uncontrolled high blood pressure, or significant leg pain, should consult a healthcare provider before trying new positioning techniques. For those with mild swelling or occasional nighttime awakenings, though, it can be a safe and practical addition to a bedtime routine. Consistency builds results. When practiced nightly, this habit becomes part of a calming pre-sleep ritual, reinforcing the body's natural cues for rest. Over time, seniors may notice fewer nighttime bathroom trips, less leg discomfort, and smoother transitions into sleep. Small, intentional habits often create meaningful improvements. In many cases, supporting the body naturally can be more sustainable and safer than relying immediately on medication for better rest. If you found this helpful, remember, better health doesn't always require complicated solutions. Sometimes, small, consistent habits create the biggest results. For more practical, science-backed tips to support healthy aging, sleep, and overall wellness, make sure you stay connected. Thank you for watching and prioritizing your health.